Bismillah. Welcome to Harvard Club of the UAE, Harvard Club of Egypt, Harvard Club of Jordan, and Harvard Club of Saudi Arabia's webinar on Healthcare Tomorrow, Beyond COVID-19 and Into Our New Normal. My name is Sajid Ashraf, and I'm president of Harvard Club of the UAE. Before we begin, just some quick requests. Please keep yourself on mute and turn off your video. Also, just a reminder that we will be recording and posting on social media. Also, if you could rename yourself so it is your name _HC and your country, that would be great so we know where you're from and which club you're part of. As we know, COVID-19 has allowed us to come together across geographies in a very unique way. As alumni communities, we thought it's nice to connect on a more human level, so we're pleased to present this series of webinars, and this is actually our fourth in our series. We also felt particularly that we could all learn from each other by sharing our views on what will be the impact and outcomes for us across this region and how we can hopefully see some silver linings. Today, we have the opportunity to hear reflections and thoughts regarding our region from fellow alumni who are all specialists in the health sector. We have Dr. Hamda Kansab from the UAE, Dr. Anas Khan from Saudi Arabia, and Riyadh Armenianis from Egypt. And we also have Salma, who's our moderator and is from Harvard Club of Jordan. Thank you all so very much for taking the time to share your perspectives. Let me quickly run through the program. After Salma introduces the panelists, they'll each share about 5 minutes of thoughts and reflections of their respective sectors. We will then have a moderated Q&A, so please send your questions via the chat box. Thereafter, we'll have a short conclusion and we'll hopefully end at the latest by 6:15 p.m. I'd want to thank my fellow Harvard Club leaderships for coming together and collaborating. I'll now request Basil, president of Harvard Club of Jordan, to say a few words. Basil?
Thank you, Sajida, and hello everyone. My name is Basil Araj. I'm the president of Harvard Club of Jordan. On behalf of Harvard Club of Jordan, I would like to welcome you all to our today's session, which, as Sajida just mentioned, is a part of a series of sessions that Harvard regional clubs are cooperating to deliver. The topics that we're talking about are carefully chosen and selected in consultation with the club leadership, which we believe are of interest to the Harvard communities. And we still hope that we hear from you guys. Any ideas regarding future topics are welcomed. I'm sure you all share with me the importance of today's topic, healthcare tomorrow beyond COVID-19 and into our new normal. The pandemic, as we all know, has created a crisis that impacted our lives and determined new rules that we all have to have no choice but to follow. I'm sure you're all, and also myself, are eager to listen from our distinguished speakers. So thank you for joining, and I hope you all enjoy the session. Back to you, Sajid.
Thank you, Basil. It's always such a pleasure to collaborate with Harvard Club of Jordan, and we welcome future participation, and we welcome some ideas, as Basil has said, around future topics that we should consider. So thanks again, Basil. I will now request Reda from Harvard Club of Saudi Arabia to please say a few words. Reda?
Thank you, Sajida. On behalf of the Saudi Harvard Club, I would like to thank Sajida, first of all, for initiating this conversation and webinar series. And we think this is a great opportunity for future collaboration. I think it's probably the first time in a very long time where we see such an intense level of collaboration between different Harvard clubs. And I think this is creates a lot of added value for many people of the club, and especially in such difficult circumstances. And we hope that continues, and we ask everyone within the clubs to build on this opportunity to come up with new ideas and propose different ways of collaboration, because I think it all will benefit the members of the Harvard community as a whole. Thank you all. I'd like to thank the leadership of the clubs for coming all together on this opportunity, and we look forward to collaboration, and we wish you a successful webinar today, and that it becomes useful to you all. Thank you, Sajida.
Thanks, Reda. And we're super excited that we're able to have KSA Club join us. This is their first collaboration with you, and we look forward to many, many more. So thank you so much for being here. Last but not least, I'd like to request Mohammed from the Harvard Club of Egypt to please say a few words. Mohammed?
Hi, I'm Dr. Mahmoud Al-Fiki from the Harvard Club of Egypt. I'm the secretary, and thank you for the opportunity to be here. We're all very glad to collaborate with all the clubs. As a physician, as a researcher, I think it's very important for all the clubs and all the schools and different countries to collaborate to see how we can get out of all this chaos. So again, thank you all to be here. Thank you all to be here, and let's all work together to make things right. Thank you.
Thank you so much. We are really particularly very pleased to have, for the first time, 4 clubs come together, and we're hoping that we can continue to work together and bring you more programming that, is interesting for our members across the region. So we would really welcome your suggestions and input. So thanks again to my fellow club leaders for working together and making this happen. And thank you to all of you for joining us today. I'd now like to introduce our moderator who will lead us through our conversation as well as our Q&A. Salma is the CEO of the Healthcare Accreditation Council, leading quality improvement and patient safety in Jordan and the region since 2012. Salma has an MPA from the Harvard Kennedy School, a PhD in health systems from the University of London, and a BSc from AUB, and has done a wonderful job in creating the conversation today. Thank you in advance, Salma, and over to you.
Thank you, Sajida, and all the club's leadership for your welcoming remarks and for putting this panel together and for modeling cooperation in our region, something that we really need, especially when it comes to healthcare and sharing experiences. And of course, I'm delighted to see so many people logging in from different parts of our region, and I think maybe the world as well. So welcome to everyone. And I hope everyone is doing well, is in good health during these trying times that we are facing. As Sajida mentioned, today's panel is about the health sector readiness, functioning in the new normal. We have to acknowledge that we are going to be living with this virus for many years to come, but hopefully there will be many solutions that we can all learn from each other on how to live with it and minimize the risks that we face from it, as well as any health problems. So in this health panel, we will be learning from the experience of handling the COVID-19 so far, while we look into the future, the new norm, where we have to live and grow while this virus is among us. We bring to you experiences from the Middle East, Gulf, and North Africa, addressing issues such as the skills and education of healthcare professionals, national responses to the emergency, and last but not least, the hottest topic of discussion these days, will we have therapies and vaccines to fight the next round, the next peak, the next wave, whatever is coming our way? Before we start, I will take a few minutes to quickly introduce our esteemed speakers, each of them having a very impressive and long experience, which we have already shared with you, and you may have read a little bit about them. I will introduce them in the order that they will speak. We will be kicking off the discussion with Dr. Hamda Khan Sahib from the UAE, who heads the medical research in Dubai Health Authority and is a family physician, whom I'm sure during the stressful period has been on continuous call from all types of questions and patients and family and all of that. Hamda brings clinical research and public health together as well, and has focused on medical education, which many of you will agree with me has been a very important topic during the response to COVID-19. After we listen to Hamda, we will hear from Dr. Anas Khan, who is currently the Director General of the Global Center for Mass Gatherings in the Ministry of Health in Saudi Arabia. Very fitting to the times we live in now, Anas did his residency in emergency medicine and his fellowship in disaster management, and teaches also in these areas. Basically, just what the doctor prescribed in these times. And last but not least, of course, Riyadh Armanios from Egypt, who's currently heading one of the leading pharma groups in the MENA region. He's focused and passionate about health as a human right, and from his T20 organization is empowering people through leveraging highly educated youth to shape the capacity of the future. from his pharma angle, he will share with us the hottest topic on therapies and vaccines. So these are our speakers. I'd like to remind everyone that you can put questions on the chat box, and we will take them after we hear a little bit from each one of them on their views of what has been happening and where they have been involved. I'm going to unmute Hamda, Dr. Hamda, and ask you to start with us, maybe with some insights on the skills and education of healthcare professionals, access to healthcare. Let's hear from you.
Thank you very much, Selma, and thank you, Sajida, and the club leaders from the 4 countries for putting all of this together and for inviting me to this panel discussion. Of course, COVID-19 pandemic it was a stressful challenge for all of us in the healthcare. And especially for physicians, healthcare workers, the skills and education of those physicians and healthcare workers was impacted. There were several challenges, and alhamdulillah, we were able to overcome some of the challenges and we addressed them. So one of the challenges that we faced is the shortage of healthcare workers when the pandemic occurred. Of course, especially in some specialties where we needed certain healthcare professionals and, for example, intensive care unit, people specialized in intensive care, people specialized in infectious disease, even public health. So it was really challenging for this time. And some of the things that happened even in medical education where training was also impacted. We have residency programs, and here in Dubai we have 16 residency programs in 16 different specialties. And it was really important for those residents to put them in the front line because they had to fight this pandemic with the other healthcare workers. But it was really challenging to balance their educational needs and service delivery for the community. This was one of the challenges as well. Learning the new skills because as you know, we had to train some healthcare professionals in the proper way of testing the nasal swabs. And this was really important because not only healthcare professionals, not only physicians were involved in this, even we had to train some nurses to help for example, we had to open some screening centers. We had to reform some of the clinics to make them as fever clinics where we only accepted patients suspected with COVID-19. So it was really important to train them in new skills. Even personal protective equipment guidelines. This was really important, training in that area. So there were really some challenges, and we tried to overcome some of these challenges, and especially nowadays, like what we're doing now, we're meeting virtually. So most of the training and the academic activities switched into virtual platforms. And this is what we did for our residents even. Their academic days, which some of the programs, they have activities where they meet to discuss cases for journal clubs. All of this happened virtually. So this is one of the things that we try to overcome. Another thing was the availability of resources. So our library team in Dubai puts very useful resources available for all healthcare professionals in Dubai. And one of the initiatives they did was the one-click article, where any healthcare professional can access the online library and with one click access some of the updated articles. So we try to make resources available for everyone. Research as well. We saw a big increase in the number of researches that were applied. They were applied to be approved in Dubai. So the number increased a lot because so many healthcare professionals were interested to do research related to COVID-19. And so many people appreciated the importance of research because I know with the busy schedule of many healthcare professionals, research is not always a priority. But with the COVID-19 pandemic, we saw that so many healthcare professionals interested in doing research, and not only physicians, even nurses, lab technicians. So it was really interesting. And even as an ethics committee where we used to meet, for example, once a month to review research applications, we started meeting on a weekly basis just to fast track the research applications for researchers and to facilitate research for them. So this was really interesting because we saw so many things that we were not appreciating before, or we were not considering them before. So training, research, this was really challenging for us, but it was interesting on how we try to overcome it.
That's very interesting, Dr. Hamda. We have about half a minute for you to wrap up.
Okay. So I'll just be talking about the accessibility of care, and I'll just, because it's related somewhat to the training of the physicians. Most of our primary healthcare visits switched into online or telemedicine, where we started consulting with patients on an online platform as well. So our family physicians, they started consulting patients either through the phone or with a virtual platform. And also this was really important because we had to train physicians on this, which was not something that they were used to. So it was really a challenging time, but we learned a lot, and we're still learning from this pandemic.
Thank you, Dr. Hamda. I think we are all in the same boat, I dare say, in terms of the issues that we faced, all of us, with this virus that we are dealing with. Most of our countries, and I speak on behalf of Jordan, we were also had shortage in healthcare workers, especially ICU professionals and infectious diseases. Understanding basically what is available and what not available was a very important goal for the Ministry of Health of Jordan. And then even training people on the new skills that are required, as simple as how to use the personal protective equipment was very important. And you see organizations like the Royal Health Awareness Society and the Healthcare Accreditation Council working with the Ministry of Health on designing all of that virtually, because you cannot reach the people you need to train and to give them the instructions and so on. So thank you. This was very interesting, and I'm sure we'll receive questions on it. In the meantime, I would like to move on to Dr. Anas Khan. I'm going to unmute there. I welcome you from Saudi Arabia. I understand you will be sharing with us the national response framework to COVID-19, which was based on the World Health Organization's framework, and how you implemented it in Saudi Arabia. Over to you.
Thanks, Selma. Thanks, Sajida, and welcome everyone. It's my pleasure to be hosted in this webinar. So directly to subject, Saudi Arabia has been working on this from day one, from the beginning when we started to hear the news about a query, atypical pneumonia that's starting to accumulate a number of cases in China. Then there was a high-level committee, a national high-level committee with multiple sectors involved to assess the situation. And then when the threat assessment was deemed viable, then it was even upgraded to be headed by the Minister of Health himself as a public health emergency. And we worked way before the first case, around 2 months before the first case to appear in Saudi Arabia. Many actions were taken. The response was all over across. And usually you are as strong as you were prepared. So we've been dealing with MERS as an endemic for a while, which is another atypical coronavirus. And we are usually dealing with the annual Hajj, which will give the huge demand for health services, in addition to the ongoing increasing expectation from the healthcare industry in general. We've been going through recently a transformation, a healthcare national transformation as well. So all of these together has put us in leverage us in a situation where we had the framework from the beginning. We had the first item is the national response, the planning, the framework, to have all stakeholders involved. It's not a health issue alone, as we saw. It changed the way we live. So you name it, 24 agencies all involved, all daily meeting and having high-level actions. And then the second part was the risk communication and community engagement, because you can put all the plans you would think about, but if you don't relate and communicate it in a simple way, and you hit the right tone to the public, you need to watch them every day. You need to be the validated source for them. You don't want anyone to go astray and try to get news from rumors. We had a daily platform where the daily high official from Ministry of Health would relay every information daily and as the credible source. So that really helped in augmenting all the attention of the society toward one platform, and was able to have and direct the resources of the community and the response in the direction that is has proven to be the best for the health response. The third part was the epidemiological response, tracing, the contact tracing, the alert response system, and the rapid response teams, where we had the contact tracing in a good way. We had a system from the beginning, we called it HISN, where we are able to track all the cases in the country, have the full epidemiological data, and then start the contact tracing early on. The fourth item is the port of interest and the transportation. Actually, we took the decision early on to have each country international level as to classify it or to do an assessment and to prioritize the risk in each country and decide accordingly where to ban travels from. And eventually, when we, as every country, we reach the stage of banning all travels from abroad. But we started early on, and that helped by limiting and mitigating the risk from these cases. And even after the cases have started to increase internally, we had the curfew, or started with banning travel between the 13 regions within the country. So that will help to decrease the unmitigated transportation and decreasing the over probability and risk for the disease transmission. Also, we work on the capacity of the labs, where we were able to augment the response. We even outsourced many or brought mobile labs with very high levels of operations. And that helped a lot in augmenting the response and having the capacity to respond, because we took the early, when we, in the beginning, we started to prepare early, we were able to see the lessons from different countries. So the most viable or the most successful experience was South Korea. So, and the magic word for them was the white testing, and that was our approach. So we went ahead and we did the mass testing for the whole community. We reached a very high numbers of testing, more than 5 million testing so far, in addition to the population. And that helped us to trace and know what's the pattern of cases. And actually that was a major part in having one of the lowest mortality rates in the world, because we are over testing. So we almost have, our mortality rate is 1.1, where it's around 4 or more than 4% international level. And that in addition to the youth bulge that we have. Also, we have the infection control. We augmented the system as well. And the hospitals to be prepared for, where we increase the search capacity for everything. And the magic word for that was repurposing. So we worked on the staff, the space, the system, and everything. And the logistic was...
Dr. Anas, this is very, very interesting. We need to wrap up in 30 seconds.
Yeah, so the last two items, just to wrap up, as you mentioned, we have the logistics, because without gadgets, we are just someone as a scientist, so it's not much of a clinician. And to help the clinicians and the public health officials, we needed much of magicians who can move stuff around and you'll be able to work with all the equipment you need. The last part was the sustainability of the healthcare system. So when you have COVID, you still have the other diseases. So we prepared the system for that, and we might leave that point for the next round, if you may.
Absolutely. I think we'll discuss more the sustainability of the health system and access to the health system, to sustainability and access to healthcare on other diseases diseases. So we felt at one point in time that the only disease that we're working with, the only problems that we have is COVID-19, but people remain to get ill and need access to healthcare, even for preventative purposes. And we will discuss that later. But you have definitely raised core issues to the management of the COVID-19, starting with governance at the highest leadership level, the communication issues, whether it is about telling people what's going on and communicating what they should do and not, and avoiding rumors. And maybe WHO had once said, people are not going to die from the pandemic, they're going to die from the infodemic, the information, the very high level of negative information and incorrect information that people are facing. And of course, the epidemiology, the lab capacity, outsourcing and using mobile is definitely of great added value. Jordan as a country in comparison is very small in comparison to Saudi Arabia or even Egypt, which we will move to now, but has also the areas where we were successful is the fact that we had what we call a Lajna al-Wabaiyya, or the committee for epidemiological committee that was giving all the advice needed on issues to move forward, as well as a central management for the pandemic through Markaz al-Azamat, or the disaster management center that we have here. We need to move to Riyadh from Egypt, and I'm going to unmute before that, I think. And Riyadh comes to us with a very hot issue related to the available therapies and vaccines, as we are headed towards a new wave, or to living with the disease and planning how to live with it for the future. Welcome, Riyadh. Over to you.
Thank you, Salma. And thank you for the invitation to the 4 clubs that came together to make this possible. It's really great to see Harvard alumni getting together. So first, I have to say that I really hate this word of new normal. And I really hate the new normal itself. I thought I understood what it took, to work in a sterile environment. This is what I did. This is part of my training. I'm a pharmacist. I'm a pharma guy. And then I did an HBS MBA, 2008. I wonder if there are any HBS alumni here. Maybe
there
you can
are,
raise your
actually.
hand.
I know at least
or
one
the
or
blue
two
hand.
online.
Or okay, all right. Therapies and vaccines. So first, I hope that nobody waits for the vaccine. Let me just put this out there. Unless it's for investing in public markets, or trying to expect a certain political outcome. That's my humble opinion, but I can shed a bit more light on that. With regards to therapies, I think we're seeing very good results. I think we're understanding the disease better. I think more and more medicines are being made available, are being tried. And one silver lining from COVID-19 is if you work in pharma, like me, I'm a CEO of a pharmaceutical company, it takes you years. You start research projects and you think it will take years until this product goes to patients. But with COVID-19, that has radically changed. And I hope that this continues. I hope that innovation can reach patients in timing that is closer to what we've seen in COVID-19. I think localization has been very important. I think for therapies, countries that had local supply have fared better, especially in this part of the world. And I think this part of the world is Middle East and Africa. And some companies have fared better than others in terms of availability of medicines. I think we're seeing better and better results with the medicines available. Generally, there are antivirals, antibiotics, and then other medicines for critical care. And especially on the antiviral side, we've seen this region get, well, the only FDA and EMA approved antiviral remdesivir faster than other regions and in ample supply. And their localization really helped. I think we have access now to 2 other antivirals, favipiravir and oseltamivir, also known as Tamiflu. Not very effective, turns out. But we also have other, I think we have access to other medication as hydroxychloroquine, which is commercially known as Pakinil, and we have access to dexamethasone and other steroids that are used, and also a lot of access to very important products for immunity. I guess access to medication has been very important as we understand this disease, which has been quite a difficult nut to crack. I don't want to talk too long. I think that we are still in the midst of this. We say in Egypt zilzal, or midst of this earthquake. I think some countries are experiencing a second wave, a very distinguishable second wave. Other countries are just in the same wave going up, and other countries are preferring not to report as many cases. And we're also experiencing the side effects of being infected of COVID-19. A lot of sudden strokes to individuals that are younger than the average individuals getting strokes. We're experiencing immunological reactions. We're experiencing, repercussions of COVID-19 that are very interesting to understand. But we're also experiencing a lot of research that is going into trying to improve the therapies. We're experiencing research that is between multiple different countries in the region, which is very promising to see happen. And we have a lot of reason to be hopeful. I think we will have to live with COVID-19. So my closing remark would be, whatever we do, we have to give ourselves the best fighting chance. And control measures are great, but if we're going to live with it, I think we have to work on our immunity more than anything, just to give ourselves the best fighting chance. And with that, I would like to hand it over to Salma.
Thank you, Riyadh. I think you were very clear about, by expressing your feelings, that you are not you're struggling with living in this new norm, no matter how much logic and education and understanding and communication information has been communicated to you. And I think everybody shares that. Nevertheless, you put it very nicely that we need to fight whatever, to give ourselves the best chance to fight this disease through strengthening our immune system. And I'm very glad that you raised the issue of therapies, that the focus needs to be more so on therapies and cure than just waiting for a vaccine to happen, which, as you mentioned in your opening sentence, may be a long way, and that should not be what we are waiting for at the moment. I have questions, and our guests and our audience also has questions. So I'm going to start by a topic that we already opened, which is basically access of people to regular services. What were the challenges? How did you deal with it? What are we facing in the future? because this issue of lockdown or limiting the people who can come to a hospital or to a clinic, or diverting people into clinics if they are symptomatic, and keeping regular clinics open as asymptomatic. I'd like to hear Hamda and then Anas and Riyadh if you have any comments on that, especially access to medication. And then I will move on to the questions posed by our audience. Hamda, I'll unmute you. Yeah, that's part of my job here. Okay.
Thank you, Selma. Yes, of course, access to healthcare is very important, because while dealing with the pandemic and dealing with patients, positive patients and patients requiring healthcare or intensive care, or patients requiring even medical treatment for COVID-19, there was another challenge the health provision to those who are needing healthcare, such as patients with chronic disease, patients who come to the hospital with an emergency or acute presentation. So this was really challenging, because at one point at a time, the hospitals were full of COVID-19 patients. And I think this was like in April or May, where the emergency rooms were filled with patients who were COVID-19 positive and requiring treatment, some of them requiring ICU even. What happened here was we tried to overcome this. It was challenging, I'm sure, to all healthcare systems, and but we tried to overcome this challenge. For example, as I mentioned, for family or primary health care, patients were advised to consult with their physicians through the telemedicine, or do the telephone encounter with their physicians. For example, those with chronic disease. You know, here in UAE, we have lots of patients with diabetes, for example, and those patients require medications, require to be followed up, because even diabetes, if it's not controlled, it can lead to many complications. There was a telephone encounter with the patients. Our appointments were shifted from seeing patients into a telephone encounter for diabetic patients. Also, some of the clinics, because we have several primary healthcare centers, so some of these clinics were switched into a clean or COVID-free clinics, where they only provided certain services such as antenatal care or child health. So we try to make it accessible for all the citizens to be able to find their doctors or to access healthcare. But it was really challenging. Another challenge was the access to testing, because we had lots of cases that required testing. So we had to open new screening centers. Some of the facilities were turned into only screening centers. We also had the Dubai Field Hospital, where our convention center was transformed into a field hospital to be able to accommodate all the COVID-19 patients and to decrease the load on the hospitals to be able to serve other patients.
Excellent. Of course, the situation in the UAE is different than Saudi Arabia. You have a larger number of population and a more diverse, not diverse actually, you have governorates that are quite far away from the center and from where the bulk of the interventions or specialized services are if needed, and so on. So how did you deal with that?
Yes, through that. So definitely to have other advanced tertiary centers, usually they have to be pulled together. In some centers are usually in the bigger cities. That's where most of the population are. That's where the talents in healthcare will go and seek jobs in. So many of people in the peripheries used to depend on services within tertiary care center and having the travels disruptions, so that would affect their care. Even within the cities itself, when we banned or the curfew was in place, that would affect people who are hesitant to go, even if they are allowed to go. So we had an application. Needless to say, we have one of the highest percentages worldwide in social media penetration. Our population is really engaged in smart applications. So we had an application which is easy for anyone who, even during the curfew, he will just ask to go to the hospital. He will be given a route to reach the destination if that's not even a true emergency, a kind of an urgent care. But yet, many solutions were out. We had our patient safety center, which is also another WHO collaborating center. They did their prioritization for cases, for special cases, the cancer patients, the cardiac patients, the transplant patients. So every one of them, they did a guideline that specialized during COVID early on, who are the ones who will benefit from only a follow-up through a telemedicine service, or they will need visits, how often, how frequent, and how to do it, what and how you can swap within different areas to do some services that will decrease the burden of the complication that might happen. And in the same time, you will be able to optimize your resources dealing with these patients. Telemedicine, even for the private sector, it wasn't covered as a formal service. It was just a consultation that was not paid for by private insurance. At the beginning of the pandemic, it was passed on as a legitimate and official. So people were encouraged to utilize it, and there was a real surge in the need for that. And it helped a lot in covering the patient's need, and in the same time, ability to avoid complications and losing their care.
I'm very glad to hear that. As you know, we had to be innovative. Like all the countries in the world, there was no specific guidance or experience on what we are dealing with. And each country had to improvise and learn from the countries that faced more cases before it did. In Jordan, for example, medication delivery to households was one of the ways to ensure access to, especially for chronic diseases, and regular medication provided by the public sector was one of the ways. Home service was one of the ways. Another one was related also to the ability to effectuate a program called Hakim in Jordan, which is the electronic medical files. And that helped identify, as the Patient Safety Center did in Saudi Arabia, identify the high risk or the in need or the chronic cases that would need immediate attention and need facilitation of movement, especially that Jordan went into a full lockdown for almost the first 2 weeks, and then another 4 weeks with very limited movement. So on that and access to people's information, one of our audience members has asked, will COVID-19 guide us to reshape the privacy and security in healthcare? Will there be more patient data sharing? Do you think that is correct or incorrect? What do you think about this topic? Who would like to start?
If you may.
Yes, please, go ahead.
So just to continue on the same note, yes, I think the innovation is a major part of our response. Every country would go and try the most effective solution from its own perspective, given the challenge, the level of challenge that they face, and given the resources they have. So in public health, it's not like the clinical medicine where things are just, you can generalize it most of the times. So this is different, not one size fits all. But in the same time, every country would see what other countries did, what they succeeded in, what they didn't, and we would learn from each other. So maybe while there was no official dialogue, but we would see every country next to us what they've been doing, and there was informal communication back and forth, so everyone will learn from, because as you mentioned, no one would ever be ready for such a challenge. For the privacy and the sharing data points, I think it's ongoing. It's been for a while. Unfortunately, for the usual innovative parts, we would go and take it from countries like USA, but we saw how politicized the environment there is for now. So it's going to take a while for implementation and more innovation to happen. We will wait for the fog to go a little bit down. Any assumptions that are held now will change pretty much soon. I think, as Riyadh mentioned, that for many parts, our optimism for vaccines, an example, or other parts, we have to be very cautious about it. We have to trust on what we have been believing in. Having the pandemic of COVID as a new challenge doesn't mean that we have to throw everything else. We have to still continue believing in the system that we used to work on. We have very strict methodologies for sciences, for legal parts that we need to build on, and not to just smash it out and start again. So I think it's going to take a while. It's been ongoing about how the best ways to reach or maintain the privacy while reach more sharing of information and data. But I don't see it happening as a disruption, if you may say, for the entrepreneurships.
Hamda, do you have anything on this?
Yes, of course, data is very important, and we rely on data for all our decision making and the methods that we use. We have some challenges sometimes because, especially in the beginning of the pandemic, the data was not collected in a proper way. But thankfully, this was improved, and the data started being collected from the cases, tracing contacts, and so many data was, even in the beginning, we had so many data that was required, such as the travel history, so many things that might be useful for us. However, here in UAE, we have a challenge is because our healthcare system is a bit fragmented, because we have Ministry of Health, we have the local governments. So we are facing now a challenge to combine all our data, and hopefully we are working on this, because with the COVID-19 situation, it enabled the whole country to work together and to collaborate the forces. So even in data, we hope that we will get a database that will contain the data of the whole country, because it's a bit challenging for us.
Before I move to Riyadh and see if he has to comment on this and then ask him the next question, the gentleman, Muhammad, who has actually asked this question on privacy and sharing of information, has quoted that Jordan has a program called Aman, which you download on your phones, and now is sort of obligatory for the public sector, and I'm not sure for people working in the public sector, and I think almost obligatory for those working in the private sector, to download it, which basically tracks a person's movement and then would be able to give information to the Ministry of Health if that person was in contact with an identified case. And there's a lot of discussion on, is this allowed? Should it happen? Is this breaching of people's privacy or not? On the other hand, it may be good and it helped identify, as Muhammad was mentioning, a lot of cases who have been in contact and therefore screened early on, and so on. So this is the controversy of the privacy of data at the moment that most countries are still struggling with. Riyadh, do you want to comment on that? And then I have a question for you.
Yeah, sure. So first, I personally believe, and many would believe, that COVID-19 has brought the future faster. And anyone that looks in the future believes that the future has more data and hopefully more sharing. So in a better future, there would be better sharing. The problem with data is privacy. So if we separate the name of the patient from the other attributes that, that are still very helpful, we can still benefit from the data without affecting the person, without going back on the person, okay? I think what COVID-19 has showed us is that citizens, patients, everyone is more willing to share data faced with life-threatening situation, this one being health-related. And I hope that governments will go beyond tracking movement as data sharing and towards more health-related patient data. I think just like what Dr. Anas was saying, innovation will enable data sharing. And I think the faster adoption of innovation will create a big need for the data sharing and having data more open source. I think non-Arab neighboring countries have better data structuring and sharing that they pride themselves with, that I hope our countries can learn from, not follow, but learn from. And I think a big part of the cost of medication comes from the cost of data. And sharing of data just really helps, first, speed of therapies going to market, and second, kind of democratizing innovation in therapies, which would help this region quite a bit and reduce this dependence on countries that have huge budgets, that have very high prices, in dependence on research that happens in these countries, just because medication has these high prices. Thus, innovation usually happens there and not closer to home. So I think everybody needs data sharing. I think it will happen. And I really call on the politicians in this group to improve interoperability of data, ability of sharing of the data between systems, so that we can have data that is more useful. Our data, we use our data instead of using the data of a bunch of Caucasians that are in the US and trying to understand what this would mean for us in this region.
Absolutely, and this impacts, for example, issues like the regular flu vaccine, which is developed and designed based on trends in Europe and the US, and then a lot of questions come: is it applicable to the types of viruses that we are facing in influenza viruses we are facing in our part of the world? So data sharing, this takes us to several important questions that have been asked. And Riyadh, I'm going to start with you. I'm going to list two questions in a row because I think the answer will cover both. One of our audience asked, how do you know, or how are countries collaborating or directing resources to deepen the understanding of treatment and long-term effects of the disease or the treatment on, for example, vascular problems or cardio problems? So are we looking into these things, and are our countries sharing this information or working together? And the other question, which is similar on this, why aren't countries working on both the medication and the vaccine at the same time together? Do you have insights on those two questions?
Let me say what I know. Hopefully it's somewhat insightful. So our country is looking at understanding, the repercussions of COVID-19 for sure. Most of our countries have a COVID-19 committee, a higher committee, or a working group of sorts that includes statisticians, clinicians, and public health professionals. Egypt is no exception. I just know a little bit more about Egypt because this is where I reside. Are these committees sharing their findings? I believe so. But I think some of these committees are still overwhelmed, And I think the findings are, we still need a little bit more time to really analyze the data and really look through the numbers. Why aren't countries working on therapeutics and vaccines? They are. I think they are. And I think for some political reason, vaccines have been hailed as the solution, the trigger that will influence the markets for some reason. Now, I don't think we should wait for them because I think it will take something like a whole year after the approval of a very effective vaccine till it reaches people that need it. Now, with vaccines, you need to protect. So you need to protect everyone. With therapies, you just treat those in moderate cases or those in critical conditions because, in mild cases, people can stay at home and take a paracetamol pill or something. So I think, in dealing with a crisis, cures are much more valuable. Now, cures take a long time because the data and because of the way we develop therapies. Vaccines, I think, take a long time to prove effectiveness, to prove protection. And although this virus does not mutate as often, as fast as seasonal flu, but it still mutates. And we're working on COVID-19 in the end of in the end of 2020 and expecting vaccines to come in 2021 and take a whole year to get manufactured if there is enough manufacturing capacity. But still, politicians are talking about finding the vaccine, not protecting everyone, which I think is the more interesting topic to talk about. But then I think politicians need to say something. So they've been saying stuff.
Absolutely. It's not easy, both the political pressure that the politicians feel and the need to give hope and to promise something versus we are treating people and there are so many people who are surviving the disease, and that's also an important way moving forward. There are questions on research and development. I'm going to start with Hamda and then move to Anas, and I then think we might have to wrap up as we come closer to our 1 hour slot that we scheduled for this. So the questions by the audience, and one of them is a specialist librarian who says, who's asking basically how much the healthcare or has seen in her experience the healthcare professionals were in need for research and information to fight for COVID-19. Another question is, why doesn't the MENA region perform its own research and development on the vaccine, or for that matter, on therapy? Know if our countries are collaborating or directing resources to deepen are directing efforts to increase funds to conduct research projects. So research also needs a lot of funding and a lot of investment in if scenarios. So are we, what do you know about all of that, Hamda? And then I'll move to Anas. Oh, I need to unmute you. 1 second. Here we go.
Yes, thank you, Selma. Yes, of course, research is very important during this time. And as I mentioned in the beginning, we've seen lots of interest in research. But however, the thing with research is that it takes time for the results, especially if we would like to try a new treatment. We have some clinical trials here in Dubai, but however, they've been experimenting with the drugs that are available. Such as some of the antiviruses, hydroxychloroquine, dexamethasone, and so on. And we're doing this on our local population. However, the results would require some time. I agree that healthcare professionals would like results from these research to direct their own treatment guidelines. And it's really important for evidence-based medicine to have research from these clinical trials. But as I mentioned, usually research takes time. So even we've been asked by so many of our health or the higher administration in our health authority, what are the results of the research? Some of the research which has been done on a smaller sample population or a cross-sectional study, we can get the results quickly. But with clinical trials and with cohort studies, which take a long time to follow up patients, we might need a bit of time in order to have the results. But yes, I agree, because most of the treatment guidelines are based on research findings. For the financial aspects of research, of course, some of the research, such as clinical trials, would require funding. And with the challenges now with finding fundings for to treat the COVID-19 patients, for example, and the crisis from this pandemic, I think resources have been directed to other aspects, such as medications, treatment of patients. However, we had some local and even global initiatives where there were opportunities for research fundings, and they were open to all healthcare professionals. So even some of our local funding agencies, they prioritized COVID-19 research for funding. So this was interesting. But I'm not sure exactly if any of our local researchers have got the funding, or they were able to obtain the funding from these agencies, because of course they need to apply and then get reviewed, and then one or two researchers would get the funding.
Anas, anything on research in your neck of the wood, as they say?
Yes. In the last 15 years, we had so many thousands of students who went to pursue their graduate and postgrad studies in high prestigious universities. And they came back with the experience. There have been a major surge in the numbers of research and projects conducted. But that's the first step. The more steps it has to be built over years and years to have scientific institutions, to have the will fostering or ecosystem that would foster this projects and turn it into outcomes. And again, it's a very complicated, we know how research is. We want to do it in a very methodological way. An easy misstep could have a strong repercussions where people withdraw from the anticipated outcomes. An easy mistake from the medication or the vaccine could make people way astray, even from the to come the future medications. So these things again takes time, and you build upon experience and networks. And actually, we were in Saudi Arabia. We were part from the WHO collaborating studies for COVID, and now we started already the trial for the Chinese vaccine. And we've been in talks with others as well. And actually, if we also see that the most promising one in UK, it is the leading vaccine, if we may say so, because it was based on the previous collaboration between UK and KSA for MERS. So even with the previous knowledge and all these details, we know that these things takes huge amount of efforts. It needs patience. And you need the acceptance for the community, because most of our population in the area wouldn't accept to be to receive a medication that's called labeled or as a trial, because the way it resonates within our culture, it's not in a way that that we deem so. But things are improving. But again, it takes time. But we are on a correct track, hopefully.
Absolutely. I think what we've heard also from the audience is the importance of sharing the findings of any research. And it is unfortunate that in the Arab world in general, our spending on research and development, not only in the field of healthcare, but in every field, is very minimal out of our GDPs. And all our national agendas, I think, have been trying to push this further. But as you said, research and development require a lot of resources, a lot of well-equipped labs and researchers, especially in healthcare, and long-term assessment of the results of anything. And we look forward to hearing about the results of the Oxford vaccine, which seems to be on the front line of any other vaccine. Unfortunately, I mean, we could go on and on and on. This is very interesting, and I'm very happy that the audience are very interactive with us, which speaks and attests to the information you all have been sharing. As we do at Harvard, I want 15 seconds from messages from each one of you before I hand over to Leila from the Harvard Club of UAE for her closing remarks. Hamda, would you like to start?
Yes, I just want to say that from COVID-19 we learned a lot, and we're still learning. So it's really interesting how things have changed and in a short while, and how things have reformed in the medical field. The thing is, the most important thing that people have learned now is the importance of being active, being healthy, and the importance of keeping, because as you know, like with COVID-19, the most complications were with the people who had chronic diseases, were not having a healthy lifestyle. So this is really important. And of course, the importance of research was appreciated by many. So these are interesting things, and we hope to a better future and better healthcare systems.
Inshallah. Thank you so much, Hamda. Riyadh? I need to unmute. Yes, of course. Here we go. Did it work? Yeah.
Yes. So with regards to the crisis, I think we are in a ceasefire phase. We're in a breather. So let's use it for what's to come. And if what's coming next is a second wave, we will be better prepared. But if what comes next is a multi-drug resistant bacteria, do we have tools at our disposal, plans to react fast, and to have different types of bullets for what's to come? So I hope we've learned from COVID-19 the importance of being prepared.
Thank you, Riyadh. Anas?
Yes, I would like to second that. And there was a saying, quote unquote, don't let a good disaster goes into waste. So we need to come up equipped with this, and not only from our framework or the response, but all our assumptions about what are the important ones, what our decisions. We saw how different factions can have long debates about what is our eyes on the ball. Is it for the near terms or for the long terms? And how we decide what we need to reach, and putting the end in mind will ease everything after that.
Thank you, Anas. COVID-19, as you know, in Jordan, I work in the world of quality improvement in healthcare and patient safety. And COVID-19 has imposed on all countries to focus more on these two areas if we want to see a silver lining, if there is any, in this. And it has pushed a lot of the things that we call for in quality and patient safety to become top priority on people's agendas and on politicians' agendas, including infection control as a major issue. I've been honored to work with the three of you and with the leadership teams of the clubs of Harvard. Really, it was very nice, and thank you so much for the time and the work in preparation for this. I hope everyone who has been with us has enjoyed the information we shared. And now it is over to you, Leila, for your closing remarks.
Sure. Thank you, Salma, for your excellent moderation. We really covered such a wide range of topics today. It was fascinating to listen to all of your remarks. We talked about training and research development. We talked about privacy and collaboration, vaccines and therapies, and lifestyle changes. But really the takeaway I think that you've all mentioned as well that was very strong to me is that although there have been lots of changes and challenges, it's a moment for opportunity, which allows us at least that little bit of optimism. So I think it's been quite a sober but not necessarily dismal look at this situation. Your experience has just been fantastic to listen to. Thank you so much to Sajida from the Harvard Club of the UAE, to Nawal and Basil and Nawal, I suppose, in terms of protocol from Harvard Club of Jordan, and of course yourself, Salma, for moderating. From Mahmoud from Harvard Club of Egypt, and Reda from Harvard Club of Saudi, and of course, most importantly, to Hamda, Riyadh, and Anas, our fantastic speakers today. Thank you so much for sharing your insights, and to all of our participants for joining us on this webinar. Please do join all of your respective clubs' social media accounts and newsletters so that you can find out about more webinars that we'll be organizing in the future. Thank you very much, everyone.
Bye, everybody. Thank you so much. Thank you, Salma, Hamda, Riyadh, Anas. Thank you so very, very much. Take care, everybody. Stay well.